It's true that high blood pressure is often called the silent killer. Most of the time it doesn't hurt or show clear signs until something bad happens, like a heart attack or stroke. A lot of older people get high blood pressure over time without any clear signs. It's very easy to miss this slow hidden danger. Even more dangerous are the things you do every day that affect your blood pressure without you even realizing it. You can choose these easy things about what you eat, how you move, and how you deal with stress. You might think you're doing great because you're taking your medicine, seeing your doctor, and trying to stay busy. But small mistakes can be hidden in these habits. It might not seem like a big deal, but these mistakes can slowly raise your blood pressure or make your treatment less effective. They put stress on your brain, heart, and blood vessels without you even realizing it. That's why it's so important to know about these secret mistakes. It's not meant to make you feel bad or blame you. Instead, it's about giving you clear, useful information that you can use right away to make simple changes that will improve your health. You can take charge of your high blood pressure even if you have had it for years or are just now starting to pay attention to your numbers. Take care of your blood pressure is more than just looking at numbers on a computer. It's about having more energy, thinking more clearly, sleeping better, and being sure of yourself in life. First, you need to know what not to do and what to do instead. First, let's look at the first big mistake that a lot of seniors make that can quietly raise blood pressure. They don't take their medicine, or they take it the wrong way. Taking medicine for high blood pressure is often the first thing that people do to control it. Taking the medicines your doctor prescribes can help you keep your numbers in check. You have to take these medicines every day in the right way for them to work, though. Seniors often and dangerously make the mistake of missing doses, taking pills at the wrong times, or stopping their medicine without first talking to their doctor. When you make these decisions, they may not seem important, but they can lead to big problems in the long run. Some people forget to take their medicine. Some people are okay and don't think they need it anymore. Some people are afraid of the side effects or don't want to take a pill every day. To save money, some people even cut pills in half or only take them every other day. You can see why these things make sense, but they can make your blood pressure go up and down. This gives your heart more work to do and raises the risk of having a stroke, kidney damage, or heart failure. The medicine for your high blood pressure was picked with care. It's not enough to just lower a number. You also need to protect your heart and blood vessels. Your blood pressure can rise even if you don't feel it if you miss doses or take your medicine at odd times. This damage builds up over time and hurts your organs and vessels. It's easy to forget how important the medicine is because you don't feel different after taking it. In the background, though, your medicine is making your heart work better and keeping your blood moving easily. You can avoid making this mistake, which is good news. Do not question taking your medicine, make it a habit. Every day take it at the same time. Pill boxes, timers, and checklists can all help you remember. If you forget to take a dose, don't take 2 until you talk to your doctor. Always ask your doctor or nurse for help. Tell your doctor right away if you feel bad. Most of the time you can get better results from other drugs or doses that don't make you feel bad. If your blood pressure seems normal, don't stop taking your medicine. Most of the time that means the medicine is working and you shouldn't stop. Before making any changes, you should always talk to your doctor. Your medicine might not work as well if you make even small changes. Also, if you're worried about cost, talk to your doctor about other choices. A lot of places give generic drugs, discounts, or programs to help people. We should talk about your health. Taking care of your blood pressure for a long time will give you more energy, balance, and peace of mind. Your heart needs you to stay on track, one pill one day and one choice at a time. Many older people make another secret mistake. They eat too much sodium, even if they watch how much salt they eat. Many of the sodium you eat doesn't come from salt on your food. Instead, it comes from other foods you eat. Salt, and having too much of it, is linked to high blood pressure. Your body holds on to water when you eat salt, which makes your blood vessels bigger. Your artery walls are under more pressure because of this extra blood. Over time, this pressure can hurt your heart and cause a stroke, heart attack, kidney damage, or other major issues. It's tricky because too much salt doesn't sound like it hurts. It's simple to forget where the salt is in your food since you don't feel different right away. There is a lot of salt in a lot of packaged foods. A lot of salt can be found in canned soups, sauces, frozen meals, breads, deli meats, and even foods that look healthy like whole grain snacks or low-fat salad dressings. Not only does salt make food taste better, it also keeps it fresh longer. Some light, diet, or heart-healthy foods may still have a lot of salt in them to keep the taste and keep them fresh for a long time. You quickly take in a lot of sodium when you eat these salty foods, often because they are easy or familiar. When we get older, our kidneys don't filter sodium as well, so our bodies are more vulnerable to its effects. This is even more important for older people. These days, even small amounts of salt can raise blood pressure more than they used to. It can also make fluid build up, which can make swelling worse or put more stress on the heart if you already have it. One way to fix this is to pay attention to how much salt you eat. Pay close attention to labels now, not just for fat or calories, but also for salt. It may surprise you how much salt is in the things you eat every day. One can of soup, for instance, can have more than half of the salt you need each day. If you eat it often, even a piece of bread or a bowl of rice can add up to a lot. When you can pick foods that say low sodium, less than 140 milligrams per serve, or no added salt. Taking real steps also helps. Before cooking, rinse canned veggies and beans to get rid of extra salt. Pick fresh or frozen foods that don't have sauces on them. Make more meals at home where you can choose what goes into them. To add taste without salt, use pepper, lemon, vinegar, herbs, or spices. For people who are used to salty foods, it might taste bland at first, but after a few weeks your taste buds will get used to it. The real tastes of food will come through more clearly, and spicy foods may even seem too strong. You don't have to give up tasty foods to cut back on salt. Instead, choose foods that are good for your heart and make you feel better. With each bite, you take a step toward being healthy. Another very important mistake you should not make is not checking your blood pressure at home often. It can be hard to manage your blood pressure because you don't always feel it, at least not until it gets too high and causes something bad to happen. It's easy to miss changes that happen slowly over time because of this. A lot of older people only get their blood pressure checked once a year at the doctor's office. But that reading doesn't show everything. Every day your blood pressure changes based on what you eat, how stressed you are, how much you move, and even the time of day. If you're feeling worried, the number might be higher at the doctor's office. If you're having a good day, it might be lower. That's why it's so important to check your blood pressure at home. That way you can see how your blood pressure changes over time better. If you don't check your blood pressure often, you might miss signs that your medicine isn't working as well, or that new habits or things that stress you out are making it go up. Also, you might not know if a new vitamin or drug is making your treatment less effective. For now, you can only guess about your health, which is not a good idea when it comes to your heart. These days, home blood pressure monitors are cheap, easy to use, and have big screens that make the numbers easy to see. Set a time every day to check your blood pressure. For example, check it first thing in the morning or early in the evening. Take a reading while you sit still for 5 minutes. Keep your feet flat on the floor and your arm on a table. Don't talk during the test. Every day do this to get a true picture of your blood pressure. You should also keep a record, either on paper or in an app, and bring it with you to every doctor's appointment. Your doctor can use this record to look for patterns and decide if your treatment needs to be changed. Some people don't check their blood pressure because they are afraid of seeing high numbers, which can make them feel stressed. But ignoring your blood pressure makes things worse. Checking often is the first thing you can do to protect your health and take charge. That way you can talk to your body in a way that helps you understand how it is doing and what it needs. As a calm daily practice, check your blood pressure. This will be a great gift for your heart. Now that you know the 3 biggest mistakes people make that raise their blood pressure without them realizing it: not taking their medicine, eating too much salt, and not keeping an eye on their numbers. Let's look at some other mistakes that could be hurting their heart health without them realizing it. That's not all. The next part will show you even more easy changes that can make a big difference in your life. Now that we've talked about how skipping medications, eating foods with hidden sodium, and not regularly checking your blood pressure can all hurt your heart, let's look at some more mistakes that many seniors make that are easy to miss but can have a big effect on their blood pressure and health as a whole. These habits have to do with how you deal with stress, how active you are, how much coffee and alcohol you drink, and how you interact with your healthcare providers. Even though each one may not seem important by itself, they can either make your heart stronger or weaken it over time. The good news is that you can change each of these habits one step at a time. Each good change brings you closer to better health and a more confident life. Mistake number 4 is not taking care of your stress. Stress isn't just something you think about, it affects your whole body. Hormones like adrenaline and cortisol are released by your body when you are worried. They get your heart beating faster and blood vessels tighter so you are ready for fight or flight. This response works well for short periods of time, like when you need to get away from danger. If, on the other hand, you live with worry every day, it makes your heart work too hard all the time. Your blood pressure goes up because of this constant stress, which can cause major health problems over time. A lot of people don't know how much stress they are under because it can show up in quiet ways. Shoulders that hurt, trouble sleeping, feeling too much, or a tight chest are all signs of it. People don't always pay attention to these signs because they think stress is normal or because they were taught to tough it out. But ignoring stress only makes it build up inside you, making you tired and raising your blood pressure without you even realizing it. Luckily, dealing with stress doesn't have to be hard or cost a lot of money. To calm your body and mind, do things like take deep breaths, walk slowly, stretch, spend time in nature, listen to music, or talk to a friend. Adding peaceful times to your daily schedule can help your heart relax and lower your blood pressure. Managing your stress is like cleaning your teeth. You do it every day to keep problems from happening, not just when they do. Take care of yourself if you've been stressed for a long time. It takes time to change, and every little bit of peace you get is good for your heart and mind. One breath, one step, and one quiet moment at a time. The 5th mistake is ignoring the fact that you aren't moving around. Sometimes what you don't do is just as important as what you do. You may not notice it, but sitting too much and not moving around enough can make your heart work harder than it needs to. Being active is like giving your heart medicine. It helps your heart pump blood better by making it stronger. It takes care of your blood arteries and keeps them flexible. Inflammation goes down, weight is controlled, and stress goes down when you exercise. These are all great ways to keep your blood pressure steady. But a lot of seniors have problems that make exercise hard or impossible, like joint pain, being tired, or being afraid of falling. Good news, you don't have to work out hard to keep your heart healthy. Gentle exercises like going around your block, stretching first thing in the morning, or doing easy chair exercises while you watch TV can make a big difference. Try getting up and moving around every 30 to 60 minutes if you sit for a long time. You can march along, do shoulder rolls, or tap your toes. Long times of sitting can make your arteries stiff and raise your blood pressure over time. These short bursts of movement can help you stay healthy. The most important thing is to make moving a habit. Do things that you enjoy, like gardening, dancing, water yoga, or stretching in the sun. When working out is fun instead of a chore, you're more likely to keep it up. Talk to your doctor or a physical trainer if you don't know where to begin, or if you are worried about your health. They can help you find tasks that are safe and good for you. Don't forget that this isn't about becoming an athlete. It means staying strong, staying independent, and giving your heart the care it needs to last for many years. Moving around is good for you, and each step you take makes you stronger and healthier. Mistake number 6 is drinking or using coffee too much. A lot of people like to drink coffee in the morning or wine at night. Everyday things like these can make you feel better and help you relax. But for older people who are already dealing with high blood pressure, drinking or using coffee too much can quietly make things worse. You can find caffeine in chocolate, coffee, tea, soft drinks, energy drinks, and even energy drinks. Your blood pressure will temporarily go up because it makes your heart beat faster and your blood vessels narrow. For some, this effect is small or doesn't last long. But for others, especially those with high blood pressure or who are sensitive to stimulants, even a small amount of coffee can make their blood pressure go too high. The tricky part is that coffee has various results on different people. A daily cup of coffee doesn't bother some seniors, but it might give others headaches, jitters, or a racing heart. If you usually drink coffee in the morning, check your blood pressure before and after to see how it changes things. You might want to cut back on coffee or switch to decaf if you see more signs or numbers going up. Don't totally give up your favorite drink, just pay attention to how it makes you feel and make smart decisions. It can get even more difficult when you drink. A glass of wine might help you unwind, but if you drink too much or too often, it can raise your blood pressure and mess up your medicines. It also makes you thirsty, sleepless, fat, and stressed out, all of which can raise your blood pressure. Because seniors' bodies process alcohol more slowly, the effects can last longer and be stronger than one might think. It can go from being a fun treat to a health risk to drink more than one drink a day. Taking blood pressure medicines with booze can make you feel dizzy, confused, and hurt your liver. This risk is even higher for adults who take more than one drug. On the bright side, drinking or coffee less can help lower blood pressure, make sleep better, give you more energy, and help you concentrate better. You do not need to give up what makes you happy. Herbal teas like chamomile, mint or rooibos, or warm lemon water are better for your heart. Adding fresh fruit and herbs to sparkling water can even make it taste better. You can relax and enjoy the same routine with these drinks instead of the drugs. It's important to know how coffee and alcohol affect you so you can make decisions that are good for your heart and your life. Your heart only needs to care, not be perfect. You will be stronger and more stable as you take small steps toward balance. 7th mistake, and the last one we'll talk about today, is not being honest with your healthcare workers. If you have high blood pressure, it's not enough to just take pills or eat right. You also need to get the right help and be honest with your doctor or care team. This is a mistake that many older people make. People don't always go to their doctor's appointments, talk about their symptoms, or think that everything is fine. But blood pressure changes all the time. Stress, exercise, sleep, diet, other medicines, and even the seasons can change it. Your doctor can only make choices based on part of the picture if they don't know how you're really feeling or what's going on in your life. That might make it harder to find issues quickly or change your treatment in the right way. People over 65 often don't speak up because they don't want to be seen as tough or bother the doctor. But when it comes to your health, no worry is too small. Telling your doctor about things like dizziness, side effects from medicine, a new supplement you started, or changes in your routine will help keep your treatment safe and successful. Side effects of medicines are often not mentioned enough. Some people don't tell their doctor when they stop taking their pills because they don't feel well. This could make your blood pressure get out of hand or even get worse. A simple talk could lead to changing the dose, switching medicines, or making changes to your habits that make you feel better. Bring your home blood pressure log with you to appointments, or if there is a user portal, you can share it there. Patterns over time, not just one reading, help your service figure out what works and what doesn't. Your mental and spiritual health are also important. Anxiety, sadness, stress, and being alone can all raise blood pressure. For help, your doctor can put you in touch with counselors, support groups, or community services. If it's hard for you to get to the doctor, ask about telehealth. Many offices now offer virtual visits that make it easier to stay in touch without having to leave home. It's not necessary for conversation to be long or hard to understand. It only needs to be real. Your doctor is not a judge, but a partner. They can help you more if they know more. Also, if something doesn't feel right, don't wait until your next visit. Get in touch. You should talk to your doctor about these things on a regular basis to keep your health in good shape. It's also good for your future. Taking care of high blood pressure can be hard if you try to do too much at once or expect everything to be perfect. That doesn't need to be the case though. Being aware of which daily habits have the most significant effects, paying attention to your body's signals, and realizing that you have the power to change your health one choice at a time are the most important things. A number on a screen is not blood pressure. It shows how your body lives, breathes, rests, moves, and reacts to the world around it. These are the 7 most common mistakes seniors make when it comes to their heart health: forgetting to take their medicine, eating too much hidden sodium, not checking their blood pressure regularly, letting stress build up, not moving around enough, drinking or using caffeine or alcohol too much, and not being honest with their healthcare team. Most of the time, no one notices when these 7 mistakes are made. The good news is that you can avoid them by making simple, smart habits. To control high blood pressure, you don't have to be perfect or make big changes right away. Being aware, taking small steps, and being consistent are what make big changes happen over time. It's important to know about your medicines. To keep your blood pressure steady and protect your heart, take your pills at the same time every day and never miss a dose. Also, talk to your doctor if you have side effects or problems paying for them. Keep in mind that medicine may not always make you feel better right away, but it is working hard inside your body to help you feel better. Taking your medicines with a meal low in salt makes it easier for your heart to do its job. You can eat tasty foods that are good for your heart if you pick fresh foods, read labels carefully, and cook at home with herbs and spices instead of salt. Though it takes a while for your taste buds to get used to the new food, you'll soon be able to taste the natural flavors and not want spicy foods as much. A great way to keep an eye on your health is to check your blood pressure at home on a regular basis. Your doctor and you can see how your numbers change every day. This helps you find problems early on before they get worse. Every day, using an easy-to-read monitor, sitting still before tests, and keeping a log turns you from a passive patient into an active partner in your care. Don't avoid this important habit because you're afraid of getting high results. Being aware of your numbers gives you power, not stress. It's just as important to deal with stress as it is to take pills or change your food. Hormones that make you feel stressed make your heart beat faster and your blood vessels narrow. This raises your blood pressure slowly, but it's not hard to deal with worry. Deep breaths, gentle movement, time in nature, music, and talking to friends can all help you feel better. Setting aside time every day to be calm is like brushing your teeth. It's a habit that keeps you from having bigger problems in the future. Don't rush into making these changes. Every little bit of peace will help your heart relax. Getting some exercise is good for your heart. You don't have to do squats or run races. Walking, stretching, or getting up and moving around every hour if you sit for a long time can really help. Your muscles stay strong, your blood vessels stay flexible, and your heart pumps blood efficiently when you move around often. Do something you enjoy every day. Intensity is never better than consistency. Talk to your doctor about safe ways to stay busy. If you are worried or having health problems, watch out for caffeine and booze. If you already have high blood pressure or are sensitive to stimulants, these popular treats can raise your blood pressure without making you feel bad. You can keep your habits without the risks by seeing how your body reacts and switching to heart-healthy options like herbal teas or flavored water. Balance can only be reached through moderation. Finally, don't forget how important it is to talk to your healthcare team openly. Your doctor can only help you if they know everything that's going on. Don't be afraid to talk about your symptoms, side effects, or changes in your daily life. At your visits, bring your blood pressure records and be sure to ask questions. Stress, loneliness, and worry can all hurt your heart, so take care of your mental health too. If you need help or communication, your provider can point you in the right direction. Remember that taking care of your health is a team job, and the best care plan comes from having honest conversations. Taking care of high blood pressure doesn't mean living a perfect life. To have a healthier heart and a better life, you need to be aware of it, think about it, and do small things every day. It has to do with living well, having clear thoughts, sleeping well, and moving with ease. We think that one healthy habit at a time is the best way to stay healthy. There's no need to change everything at once. Select one area to begin with. For example, you could choose to take your medicine as prescribed, check your blood pressure every day, or switch from a salty snack to a healthy one. You are getting stronger with every step you take. This video may have helped you. Please like it, subscribe to Dr. Discovery Diva, and share it with someone who could use some understanding and support. It takes one breath to make us stronger, more stable, and better able to thrive when we help each other. Today is the first day of your journey to better health. Remember that your heart is waiting on you, and that every choice you make now will lead to a future full of energy, stability, and peace of mind in the future. So take a deep breath, do one good thing, and then confidently move forward. You have the power to keep your heart safe and live a good life. Every day, let's take this journey together, one habit at a time.